Today, I would like to share an interesting and important case. A 13 years old boy present with pain and swelling of the right testes for the last 3 to 4 days associated with fever. On ultrasound, the right testis is enlarged with relatively decreased echogenicity compared to the left testis. The epididymis also heterogeneous, and if we give the color Doppler, it shows hypervascularity, and also the spermatic cord is thickened heterogeneous, and it also shows increased vascularity. But the left testis and epididymis is normal. See the right testis and epididymis and cord. This is the right testis, this is enlarged in size. The epididymis is also thickened and heterogeneous, and see the cord is also thickened and heterogeneous. The color Doppler, see the left side and the right side. On the left testis it shows the normal vascularity, but on the right test side it shows the increased vascularity. And see the color Doppler on the right testis and epididymis. The right testis is increased vascularity, and epididymis also increase color flow. And see the uh, cord shows also increased vascularity, and epididymis and testis also show increased vascularity. At this point, most of us confidently diagnose this is an acute epididymo-Orchitis with funiculitis based on the color Doppler finding. But here is the important learning point. Many of us stop after demonstrating increased vascularity on the color Doppler. However, we should always go one step further and perform a spectral Doppler. If you question me why, because color Doppler tells us that blood flow is present, but spectral Doppler tells us how that blood is flowing. The blood flow is present in all the phases of the cardiac cycle, like systole and diastole, in the important organ of our body. See the left testis, this is systole. On the systole the flow is forward, and on the diastole also the flow is forward. But on the right testis, see the waveform. The waveform on the systole there is a flow, but on the diastole there is no flow in this segment. And see in the another segment there is flow seen in the systole, but on the diastole there is reversal of flow. So if the waveform demonstrate a high resistance pattern, that means absent end-diastolic flow, reversal end-diastolic flow, it suggests that intertesticular vascular resistance is significantly increased. This, this findings raises concern for impending testicular infarction due to severe edema and vascular compromise. This patient required urgent clinical attention and prompt urological evaluation. Even if the acute infection eventually resolves, the ischemic areas may undergo segmental necrosis and fibrosis. On follow-up ultrasound, these regions may appear as persistent heterogeneous echotexture within the testis. So, the take home message is simple. Don't stop at color Doppler. Always assess the spectral Doppler waveform. Sometimes the waveform reveals what the color image cannot, and it may be the key to identify impending testicular infarction before irreversible testicular damage occurs. Thank you for watching.